Hey guys, my name is Jamie and I am a second year emergency medicine resident. So about 3 weeks ago, I was hospitalized at my own hospital as a patient. And I think the whole experience was really eye-opening and interesting. So I want to share my story with you guys.
Hey everyone, I am currently in the hospital, actually in the very emergency department where I work because I started having a lot of abdominal pain earlier in the day after I woke up from my night shift, and then it just wasn't going away, and I was having nausea and vomiting. And it went on for like 4 hours without stopping. And I had a feeling that something wasn't right because I've never had anything like that before. So I ended up coming to the hospital. I called out of work today. They ended up doing a CAT scan of my belly and showed an early appendicitis. So the surgeons came to talk to me about my options. You can do either antibiotics or you can do surgery. There's a risk of recurrence with antibiotics, but obviously surgery has its own risks too. So I chose to go with antibiotics because I'm hoping that I'll just get better since they said it's early, and then I can hopefully go back to work, and hopefully don't have to go through this again later. But I think they said about 30% chance of recurrence, so we'll see.
So one of the first things that occurred to me when I started having this abdominal pain at home was that I really didn't want to go to the hospital. And I think a lot of people probably feel this way. They don't want to spend their time in the hospital, but I think especially for me because being an EM resident, I would go to my own hospital, but that means that I would be seen by my colleagues and my attendings that I already know. So I didn't want to make it seem like I was going to the hospital for no reason. I wanted to kind of make sure that I had a real illness. I didn't want to just go for any old abdominal pain that was going to go away in a couple hours. So that was like the big barrier to me going to the hospital. And I think maybe a lot of doctors feel this way. They feel like, oh, I can deal with this. Oh, I know what it is. I don't want to burden my other colleagues and my coworkers with me being the patient on top of all their other patients. So there was like a big barrier to care, at least in my mind, for that reason.
It's giving me a whole new perspective of being a patient here. Patients complain to me a lot about their IV placement and like how it's uncomfortable, and I feel like I'm getting just like a first-hand experience of what that's like, which I think is valuable. I think it's valuable to know what your patients go through. Obviously we can't experience every single illness or disease, but this is definitely giving me a taste of what it's like to be a patient here. This is my IV, and it's right on my, elbow, and it's actually really uncomfortable because every time I bend my elbow it hurts. And when I was getting fluids and medications before, I couldn't bend my elbow.
I think the most interesting part about being a patient is really seeing everything from the patient's perspective. I've never been hospitalized before, so I've never been a patient before, so this was like a really eye-opening experience for me. So for example, the common complaints that I hear from patients, like the doctors don't come see me as much as I feel like they should, or the IV where you put the IV in is really painful, and all those things that, from my perspective as a provider, it's hard for me to kind of imagine where they're coming from, but I think having been a patient, I totally understand where all my patients are coming from. I had an IV placed on my right AC, or was it the left AC? I think it was the right AC, like right at the elbow joint. So even though it's just a catheter and there's no needle there, every time I bent my elbow, it would be kind of uncomfortable and painful. And every time I was getting fluids or antibiotics, I would have to keep my arm straight the whole time, otherwise it would kind of block the flow. That became kind of uncomfortable, so later on I asked them to replace my IV not near a joint so that I can move my arms more freely. So somebody came and placed it somewhere else where it became much more comfortable. Another thing that I never really thought about before but realized as a patient is that actual face-to-face time with doctors is very limited. From a provider's perspective, I know that the doctors are always looking at your chart on the computer and looking at your numbers and kind of talking about you and your plan, but I think from patient's perspective, you don't really get to see get to really experience the full time that the doctor spends thinking about your plan. So I thought that was really interesting. Another thing that was really interesting to me was how much the nurses advocate for you. So I just talked about how the patients might not feel like the doctors are coming to see them that much, but I actually saw a lot of the nurses. They constantly checked on me, gave me my medications, sometimes brought me food. If I needed anything or if I wanted more medication, they would communicate that with the doctors. I was having a lot of pain, but being a resident at the hospital where I was at, it was really hard for me to ask for pain medication. So just imagine going to your job and asking for morphine. Like, it just feels weird. But I was like curled up in like fetal position and I was really uncomfortable. And the nurse was like, "You look really uncomfortable. Is it okay if I go ask the attending if they can give you some morphine?" And I really, really appreciated that, because I think it would have been really hard for me to be like, "Get me some morphine. I'm in so much pain." I think that would have been really hard to say, especially because the attendings are like technically my bosses. I was really grateful for the nurses kind of recognizing that I needed more than what I was getting, and then really championed for me and asked the doctors for what I needed. So lastly, after all that, I ended up staying in the hospital for 2 nights. They advanced my diet from being NPO or nothing by mouth to just liquid diet like jellos and tea and broth and things like that, to like a full diet, like a regular diet. And then when I tolerated my regular diet and my pain was better, they discharged me with oral antibiotics. I went into hospital on a Tuesday, and then I came home maybe Thursday night. So I stayed Tuesday night, Wednesday night, and then I came home on Thursday night. And I didn't go back to work until Monday, and I had tremendous guilt about not going back to work like right away. I knew I had to rest, and I knew something real had happened to my body and I was recovering from it, but I also knew that my colleagues were covering for me, so someone who wasn't working was coming into work to cover my shifts, and I felt like I was like letting them down, and I felt like I wanted to go back to work as soon as possible. Thankfully, my chief residents and all the leadership from my program really wanted me to take enough time to rest and recover before coming back to work. And I was really grateful for that. Like, I was really grateful that they made me do that instead of making me feel like I had to go back to work right away. And I think as doctors, and especially residents, we're really hard on ourselves and we don't often take the best care of ourselves. And I think it's really important to do that, because if we're not doing well, then we can't provide good care to the patients. So that was also like a very good insight that I had from this whole experience. So hopefully when I'm in the future, when I'm in the position of taking care of residents or even med students, I can pass that on and have them help them take care of themselves the best way that they can. So often it's hard to do it for yourself, but it's easier if somebody makes you rest. So that was pretty much all the lessons and different insights that I got from being hospitalized for 2 days with appendicitis. It was painful, but I feel like I got a lot out of it, and I still have my appendix and I didn't have to get surgery, so I feel like overall everything ended in a happy ending. So that's all I got for today. I just want to say thank you guys for all the nice messages that you guys sent me on Instagram when I uploaded that I was in the hospital. I really appreciate it. And I'm hoping to come back to my regular schedule of uploading now that I'm all feeling better and totally well. So I will see you guys in an upcoming video soon. Bye!